many of you in this room I know on a personal first-name basis. Many of you in this room for the past 3.5 years, we have worked together to push the plans that are now hopefully being implemented. But what you have always called for and asked is critical, and that is transparency and inclusion. So to your first question about a public hearing concerning one of the critical issues and one of the critical needs of the city of New Orleans, that of healthcare, I say yes. Let me also say that because I was able to get $40 million, not 4 but 40, for the rebuilding of charity of our Methodist Hospital, to complement the opening of Charity Hospital, acknowledging that we need health care throughout all of New Orleans, working with universal health care and collaborating with the AFL-CIO to make sure we have good paying jobs and benefits for our families. That is one of the things that I have pushed for. In addition to that, is there have been numerous meetings held by LSU, held by the community, and in the community and at City Hall. I have been there at every single one of them to make sure that I understood the issues and I understood the will and the vision of the people about the most critical need of the city, that of health care. Unfortunately, yes, the doctors went in and cleaned up the building. Yes, General Honoré walked through there and thought services would be opened up. But the state failed to help us. Just as they have failed to help us with the road home, just as the state has failed to help us with getting the dollars that the federal government appropriated. So now, 4.5 years later, we still have a shell of a building. Let me say, I am pushing for health care services. There ought to be some type of model that we can have in our charity hospital, which is the Avery Caesar Alexander facility. And with that, if indeed it is about state-of-the-art biomedical complex that pulls to VA so we can have a global perspective in terms of marketing, advertising, and delivery of healthcare services, it certainly does not have to happen on a footprint that wipes out 7.5 blocks. There ought to be a better strategy to get all of those goals accomplished. And of course, the dialogue with the community can get that happen because there's a whole lot of parking lots that we see happening. It's about health care, it's not about parking. Second, because I know